the opportunity to both visit your wonderful country and to have the opportunity to speak with you today, and particularly for Boring Innovation. Thank you for all the support the last few years as we move the research along. I'm Steve DeMello. I'm the Director of Healthcare at something called the Center for Information Technology Research in the Interest of Society. We're one of 4 organizations in the University of California that bring together multiple campuses to develop specific technologies that try to address large social issues. And in our particular case, we focus on information technology. And in my particular case, I focus on about 15 different projects that all relate to healthcare delivery and support of social services. We became interested in this project and started our work because we recognized 3 things. One was that there was an awful lot of interest in service innovation, but most of what was being written and thought about was either general or oriented toward the private sector. We contrasted that with where we saw a lot of service being delivered, which was in the public sector, and the constant reminders that you hear, particularly in business schools, that the private sector and the public sector behave in extremely different ways. And yet, up until that point, we did not see much work being done specifically on the public sector. Was there anything different? Would you behave differently in designing services? Would you look at innovation any differently? So we came together in this research to really address 2 questions. The first is there a public sector model of innovation that can be more valuable and effective in planning, analyzing, and designing activities? And then the second question was, what are the important characteristics of that model? How is it different? How is it better? And what could you actually do with it? So to pursue that work, we decided to focus on a specific content area rather than look at the theory generally. And the content area we chose to focus on was independent living, the set of services and technologies that allow seniors to stay in their home environment for as long as possible for both health services, safety services, and social services. We chose it really for 3 reasons. One was because we think the underlying driver, which is the aging of the population, is a long-term global problem that we'll be dealing with for quite a while and to substantial value in a large number of countries. The second is that independent living has both a political and a market component. If you look across all the different models of how care is being delivered today, from Europe to Japan to the United States and the rest of North America, what you see are pretty wildly different solutions in terms of who provides, what services are being provided, and in particular, the relationship that those services have to the government and to public policy, and how public policy and service delivery comes together. The third piece is that we saw what we think is the classic service innovation problem. How do you develop a framework that allows you to mass customize? A framework that gives you the basics to deliver service from, but that you can take and replicate in a bunch of different instances and do it slightly differently each time so that you meet the specific needs of the community that you're trying to serve. When we were in Oxford with the study group for value-driven service innovation in last October, Dan Franklin from The Economist gave us a timely reminder, which is that while oftentimes we think about global aging as being fundamentally an issue of the developed world or the Northern Hemisphere, that if you look at the next 25 years of trends, you'll find that it extends far beyond that, to places in the short term that you wouldn't necessarily expect, like China. And even in the slightly longer term, 10 to 15 to 20 years, it becomes an issue in the Southern Hemisphere, not to the same extent, but with increasing frequency. So we think trying to address issues and services that wrap around aging is something that's good today, will be even stronger tomorrow, and becomes more global with each passing year. The other piece that we focused a lot on was trying to look at very different models of how governments and how citizens try to address the question of an appropriate government role in providing service. And in the countries that we used for our consumer survey, the US, the United Kingdom, Norway, and Japan, just those four give us a very different picture of who provides services, who pays for services, and what the different public policy debates are. The only thing that we can find that really sits in common across these is because of the population pressure, there's an active debate in each country about what's provided, where, how, and how that's going to change over the next 10 to 20 years. So at the end of the day, we wanted to collect data and bring forward work that allowed us to ask at least 3 different questions about this area from 3 different perspectives. You know, if I'm a public policy researcher, I want to understand something about whether innovating in public services is different than innovating in the private sector. If I'm interested in innovation, I'm looking for different tools and techniques, different processes, and the things that work more or less effectively. And the final area is, if I'm a business, and increasingly businesses are entering the realm, particularly in information technology, of providing large-scale government service, I want to understand if there are some specific dynamics to building a product that I can start with in one country, but move to successively other countries over time, and do it effectively, do it quickly, and do it profitably. So regardless of what perspective you take on it, we wanted to try to provide some answers, or at least some starting points, for thinking about how to do this more effectively. Let me take a couple minutes and tell you what we did, and then the vast majority of the time to tell you what we found. We tried to approach the research in a 2-step. You know, the first step was, how do you build a framework to even look at this? And we started by saying, let's take the model that we're most comfortable with as a general business framework to think about innovation, and use that as our core. And that was the value-driven service innovation model, which Richard's going to explain in more detail and Peter introduced a few moments ago. But the more important element for us was, you know, we start from an assumption that says culture and society trump technology. So what we wanted to do was take a framework that lets us address the business aspects, which was the triangle, but match it up immediately with a profile of the culture, the people, and preferences of both the political market and the consumer market in each area. So our goal was to have not a generic business-driven model of innovation, but to say for every point on that map of innovation, is there something we can learn or something we should know about how society works that either expands or limits the opportunities, or expands or limits the specific approaches that we can take to be effective. And when we put those two together, what we wanted to come up with was a series of hypotheses about how independent living might evolve differently in each of these 4 countries. So we started from the service innovation triangle and did all of the classic looking across the 9 different sectors. But at the same time, we said, what if this triangle doesn't exist as sort of a one-dimensional piece of paper? What if there's another side to it? We wanted to think about the idea of a cone, so that on the front you can look at it as a standard sort of innovation analysis. But going back, if you turn that cone a little bit, what you can ask is, what do I know about Norwegian society that will tell me something about the values that drive it? What do I know about the innovation abilities that exist both inside healthcare and outside of healthcare that can address things like business model, customer experience, and service design? What do I know about the resources of the US or the UK or Japan that tells me whether I have more or less technology to work with, more or less fixed versus intangible assets? How do I match those pieces up? And by matching those pieces up, I can get both opportunities and I can get constraints. So what we wanted to do was have value-driven service innovation, but put it right away into a societal context. We wanted to do one other thing as well. There's the world that we know exists today. Who's delivering services, who's happy about it, who's not, who's paying for it. But in some ways, more important, what we'd like to understand is what are the possibilities in the next few years, and then what are the possibilities long term. So for us, it was important to be able to ask people and think through 3 different time frames. You know, what you have now, what you expect in the short term, where you can have maybe a little influence on how it develops, but fundamentally it's already on its way. And if you had a clean slate, if you had long-term development possibility, what would you really want? And we wanted to understand, particularly from consumers, whether those 3 things were the same or very different, and in what ways they varied, and did they vary from country to country. So once we reached that point, social analysis, consumer analysis, and innovation, we then wanted to push forward and look at, you know, what specifically consumers would tell us in each of these countries. We started in 2 ways. One way was we did a literature, research, and expert interview series to try to paint a picture of social structure in each of the countries. And then secondly, we went directly to the consumers themselves. The cultural context was something that we did, frankly, much more in sociology than anything else. We looked at a lot of research on how you would describe social systems, family systems, economics, government relationships, and collapsed down to 7 different categories, 7 different areas that we could look at and apply them to the 4 countries. And what we found, interestingly enough, was that there were wide divisions, you know, very big differences in social structure, and that each country had at least one area that was unique unto itself. And in most cases, there were no more than 2 countries that agreed with each other on any of these elements. So that gave us at least some hope at the beginning that if our theory is you're going to see different responses by different cultures, that we had significantly different cultures to take a look at this. The more important piece was the survey design. And we started with a group that might not seem intuitively logical, which is 50 to 60-year-olds. For a lot of people, I'm told that's too young, you know, particularly to think about services in the home. We chose the age group for a couple of reasons. One was that we thought they sort of straddled 2 populations that are ultimately very important for us. One are younger, beginning chronic disease patients who are having their first experiences with long-term management. But more importantly, there's a much bigger population of people who are currently making decisions to support their parents and family. So they're coming in, their first taste of this technology, their first taste of this service is not necessarily as a recipient, but as a provider and a decision maker and a support for their elderly parents, and that's how they're getting their first impression of this service. So we thought it would be better to ask a population group that was having sort of a variety of experiences with this, might also be a little bit more web savvy, you know, larger population segment, to tackle these questions. And what we asked them about were a wide variety of things. We asked them who should be responsible for delivery of in-home services for independent living. We asked them what they thought about current services and what the biggest social issues were that those services should address. We asked them about their providers, who was providing and how well they were doing it. We asked them about their use of technology, what specific technologies they were using, how they rated them, what technologies they might be willing to use downstream and why. And, interestingly, we got a lot about what technologies they wouldn't use. We asked people about privacy concerns. A, were they concerned? And then B, were they willing to trade some level of privacy for some level of support for independent living? And finally, we asked about financing. Who pays now? Who do we think is going to pay in the next few years? Who do we think is going to pay long term? So we put this out with one last test, which was, could we take those questions in the survey? Could we design the survey in such a way that we could make sure we tied back to our 2 initial objectives? One was, could we really get a clear picture from people of differences between what they face today, what they were going to see in the next few years, and what they really wanted? And the way we tried to deal with that was to map back each and every question in the survey to both the category it was designed to address and whether the answer we were getting related to present, near future, long-term future. And the second was something you just saw from Peter Inga, which was for each question in the survey, we wanted to look at the specific area within the innovation triangle that it addressed, so that we had some sense of both coverage for the triangle topics, but we could relate specific answers back to strategies in each piece of the service innovation triangle. By the way, the large block on your right, just outside of the customer sector, was we asked a series, beyond the preference questions, we asked a series of questions about demographics and health status. So we were looking to see if the answers we got were more related to people's location or more related, for example, to their particular health status, the particular services they were receiving, their age, their income, their gender, et cetera, et cetera, et cetera. So, what did we learn? Well, first we got back about 1,100 surveys across the 4 countries. There was a tight cluster of mean age, about 54 to 55 years when you boiled it down. There was some variance in gender between the 4 countries, range of 53 to 57%. In US and UK predominantly female, Norway and Japan predominantly male, 53-47 to 57-43. What linked them together was that the respondents, when asked if they needed services for independent living, would this be a small, medium, or large burden on their family and themselves, most everybody in the survey answered that taking on these services would represent a large financial burden. We had very little ethnic diversity, but a highly educated group where the primary living situation was living with spouses or partners. Of that 1,068, 125 were residents of Norway, same median average age, predominantly male, and the same general characteristics. So on the surface, the Norwegian respondents were not terribly different than what we saw from the other 3 countries. So what did we see? At a global level, we first found that there was low or moderate current satisfaction with services people were receiving and pretty low future expectations. Most people thought that services for seniors, particularly for independent living, were inadequate now, and a slightly fewer number of them thought that they would be as inadequate later. So we don't start from a high degree of hope. At the same time, we saw some really sharp differences between each of the 4 countries in terms of the role of government and both the confidence that government could participate well in delivering service and the willingness to have government as a major partner in delivering service. We found that there was low current technology use. Only one technology really played well across all 4 countries, and that was the old standard personal emergency response system, the PERS button. Beyond that, there's very little evidence of strong adoption of anything else, either large-scale sophisticated technology or small-scale technology. But across the 4 countries, with one really important distinction, there's a high reported willingness to adopt technology. That one distinction, which we're going to talk about in a couple of minutes in some depth, is remote patient monitoring, where there is very mixed reaction to it, and very different responses between the 4 countries in terms of willingness to even try it. At the same time, as I said, very mixed opinions on remote monitoring. The countries seem to have 3 issues in common. The 3 things that everybody came back to near the top of their list as the issues that need to be addressed. First, with the exception of Norway, by the way, cost. Overwhelming issue in the other 3 markets. Second, social isolation. And third, the ability to have human contact with caregivers. Those were pretty consistent across the three, although I will say, and we'll see it in a little more detail in a moment, the human issues, the isolation and the caregiver contact was absolutely front and center for Norway in a way that was much stronger than the other three countries. But while everybody had the same concerns, they had very different reactions to privacy questions. Whether they, high level of concern about privacy in general, but real differences in whether you would trade off privacy and what kind of benefits you would need to have in order to be willing to consider a less private solution. Finally, these 1,068 people had remarkably common profiles for their own medical problems. And the things that they identified most, by a pretty substantial margin, were issues of pain, anxiety, and depression. Not so much activities of daily living, not so much chronic disease, pain, anxiety, depression. But they had relatively diverse demographics for those same conditions. So some things that line up very interestingly across the four markets, lots of things that are touch points for big differences of opinion and big differences of strategy. So we think it shows there's evidence of a global market, but that the way you have to approach that market is going to have to be very tailored country to country and culture forward, not technology forward. So let me, if I can, dig in very specifically to the Norwegian responses. And starting with, the piece that was probably the clearest cut and sort of dominant theme in the responses, which is the role of government. Unlike the other three countries in the survey, we saw a high degree of desire and a high degree of confidence that particularly local and regional government is and should be the dominant provider or the dominant responsible party among these respondents, at a level that was 20 to 25% higher than the next highest country. The second piece around the role of government is that when we ask three separate things, who's responsible, who delivers, and who pays, again, unlike the other three countries, the Norwegian respondents were strong and supportive of a local regional government solution in each of these cases. So it wasn't, we want them to pay, but we want somebody else to deliver service, or we'd like them to be responsible, we'd like to receive that service, or have a payment system that's entirely different. There was a very nice consistency to the responses. And the third is that consumers expect and want government to be the dominant payer for technology and services, which is, again, a very different response than we saw in the other three countries. So, high level, consistent, and across delivery, payment, and organization was a real hallmark of the Norwegian results. To give you a couple of facts that tie back to that. Between 80 and 90% of the respondents identified local and regional government as the party that they wanted explicitly responsible for independent living services. 94% of the respondents identified regional and local government as their direct provider, which was 2 to 3 times higher than any other group, including families, spouses, in Norway. And then finally, 83% and 73% respectively, we asked a couple of questions about who should influence your decision about what you receive in terms of independent living services. And what we were trying to get was, what role, is there a role for government in being part of the discussion about what services and how they're delivered? And in the other three countries, the level of government influence was pretty low. in Norway, what we heard in the survey was that there's a recognition or a willingness / recognition that government will probably be part of that conversation, and that they explicitly identify the government as not a decider, but as somebody who's definitely at the table when services are being discussed and opportunities for service are being made. So the second area is services and user experience. And again, probably the hardest taskmasters of the four countries were the Norwegians. They had the highest level of concern that current services were inadequate, and they had a relatively small uptick that things would get better appreciably in the next few years. So there's definitely a perceived need on at least the consumers we talk to that things could be better in this market. Hands down, social isolation, lack of workforce. Those are the two issues that these folks wanted to see addressed. More so than disease management, more so than transportation, more so than about 7 other things. These were the keys. And finally, consumers identify their current and likely future living arrangements as living independently and receiving paid in-home care services. Unlike a couple of our other countries where there was at least some movement indicated toward more family, elders living in family situation, Norway respondents were very clear that they thought the pattern was going more toward longer periods of independent living where there are explicit services designed to support the ability to do that, and less responsibility on their partners and less responsibility on their families. A couple of factoids to fill in the blanks. 85% of respondents disagreed with the statement that there were adequate services. So 8 out of 10 are not feeling all that comfortable with the question about current services. 74%, so some improvement but not huge, 74% disagree with the statement that life's going to be better in a few years. And here are the top 5 responses to what are key problems that we'd like you, that can be solved or should be solved by independent living. And you see a pretty big gap after you get through social isolation and workforce to cost, security, and transportation. And both the sort of the height of the numbers for the primary responses and the gap between those two and everything else is much bigger for Norway than the other countries. Couple of points on technology. As I mentioned a bit earlier, low general exposure. Most people, if they've had any exposure, direct use of technology, had it in personal emergency response systems. The more sophisticated forms, particularly remote monitoring, no, not so much. Very little, as a matter of fact. But when you ask people the same question about each of, and we asked about 10 different technology categories, are you willing to consider it? For 8 of those technologies, there was very high support for at least evaluating the technology. The 2 where the support dropped off fairly substantially were remote monitoring and remote training. So here's percentage of respondents currently using technology. 66% responded that PERS was something that they have used or have seen. And then you drop down to a quarter of the population for medication adherence, and then below 20% for everything else, below 10% for the 5 that aren't on the table. So pretty low usage and pretty focused usage. When we ask people who have used the services to rate their performance to rate the performance of the service and their satisfaction with it, we got a big fat lot right in the middle, almost exactly a 3 on a 5-point scale. So we weren't honestly able to get much insight that added to that. But when we ask people, are there technologies you explicitly wouldn't consider using, we got a 4x to 6x spike on remote patient monitoring and remote training. 4 to 6 times more people responded no to those categories than to any other category of technology. Privacy and security is the last area. Consumers are definitely concerned over the implications of privacy for in-home service, but willing to talk about it. 66% of respondents agreed that they have concerns about potential loss of personal privacy, particularly in-home monitoring technologies. But 68% of those same folks said, if you can demonstrate to me that my ability to live at home longer or better independently will happen as a result of those technologies, I'll think about it. We think the more compelling answer is frankly the first one, the level of concern. So, to summarize, we think the key to innovation, based on the respondents, that the key to innovation in Norway for independent living is going to be a relationship with local and regional government, either as the direct provider or as a partner in the provision. We see very little support for other players taking a serious active role in either the organizing, the delivery, or the payment of services. It starts with your local and regional governments. The model should be explicitly based on a family and social structure that leans much more heavily towards people living individually and alone, where the question is how do you support them in that environment in their existing home environment with less people around, than moving them to another environment. That the core services, the core value people are going to look for is, can you reduce my social isolation? Can you make it easier for my caregivers to coordinate themselves and to spend time with me? Residents have low exposure to, but are willing to consider technology, so there are opportunities, we think, for some targeted use of technology. There isn't a groundswell out there to make this a technology-forward practice, but if you can find opportunities to use technology, particularly to work on social isolation and coordination of care, there's a willingness. And then finally, all of the planning, particularly around in-home services, ought to be considering the privacy question pretty seriously, because we think privacy is at the heart of a lot of the concern over remote monitoring and carries over to the other areas where folks are concerned, or at least on the fence about service usage. The implications, again, lead with regional and local government. Consumers are receptive to change, try to press them on it. Personal services is really the focus here. It's not monitoring, it's not technology, it's what can you do to get me closer to other people. Technology-enabled services are likely to be accepted, but the places where we tread really lightly is remote monitoring and remote training. Privacy is important, and we think that any of the business structures that you'll consider for this ought to explicitly take to heart people's desire to shift payment away from individual and family. Our plan going forward, because there is a going forward, is we hope that we've made the leap from a non-evidence-based theory to an evidence-based theory of public policy support and work around independent living. We'd like to test that in an aggressive way, moving to a validated theory by using some expert interviews and some additional consumer work so that we can see if what we're seeing in the initial work holds up over more environments and more conditions. And then the really critical step, we think, is the one that says, move the tools from being diagnostic or evaluative in nature to being planning forward, so that we know what to ask in selected markets and who to bring together to design something, as opposed to trying to explain what was good, bad, or indifferent about the past performance. Thank you all very much. Let me stop at this point, and we probably have a moment or two for questions.